Sandra? Sorry, I can't hear you. I think you're still muted.
Okay.
Yes, hi. So when I was going through the lessons, I'm not sure if it's just me, but one of the I think articles, the in lesson 3.1, the advanced in nursing theory through theory guide practice was not opening for me.
Oh, okay.
Yeah, I'm not sure if I'm the only one, but I tried this morning as well, and it says a system problem has occurred. To begin a new session, please log in. So I'm not sure.
Yeah, I had the same problem.
Okay,
Oh,
so I'll look at that and okay. And I'll either post it as a PDF or not as a link. Okay, I'll
okay,
look at that.
okay.
Okay. Perfect.
Sorry, I have another question, but it has to do
Sure.
with the paper. I'm not sure if you're gonna talk any more about the paper later in class.
I am going to talk about the paper. So yeah, just hold on to that question.
Okay.
Yeah, are you talking about which paper are you talking about though?
Uh,
The Think Global Act Local one?
yes, it
Yeah.
just has to do with the citations. So yeah, I'll ask
Yeah,
later.
just wait. Yeah, that would be great. Okay, good morning. It's 9:30. I'm going to wait one more minute, and by that time we should have at least half the class on.
Sandra,
Yes.
sorry, one more.
No worries.
In lesson 3.3, under the resources section where you have that think upstream link, what exactly did you want us looking for, like on those, like on that page specifically? Because it
Uh,
just takes it to like a home screen.
yeah, just to kind of give you an idea that in Canada we have a great organization called Think Upstream that's doing a lot of great work. So
Okay.
just more, just as a resource for you to know that that Canada does think upstream.
Okay. All right. Thank you.
Okay, so we've got half the class here, so I'm going to start. So welcome to week 3. I will leave my video on until I start to get some internet wavering, and then I will go off. So let me go here. Okay, so this is what, so very similar to last week's lesson. This is the way I like to set up the week. So we're going to start off with any announcements and any overarching questions about the course. I'll entertain any more questions about the Think Global Act Local assignment, which is due October 1st at 9 o'clock. We'll look at a couple of things, that is what's new in global health and anything that you might want to speak about. We'll do an overview of what to expect this week for Module 3, and then end up with final questions. So as you know, we're recording these Zoom sessions. And so I've been posting them under the week that we had the Zoom meeting. And so they take usually a couple of hours to process, and then you'll find the link within the module, just under the Zoom recording link. So that's where you're gonna find them. I did post about the research paper. If you're doing it in a group, there's a self-peer evaluation that I've added on to the research paper that I've uploaded to eClass now. So it's been revamped to include that. Where we're at with the ICN Collaborative Symposium, I'm almost ready to post a sign up for the topic sign up. We have 20 groups that will split over 2 sessions, so 10 groups for each session. I have 4 students with no group. So I'm asking for groups to let me know if you are interested in taking a student, another student into your group. So if you could please email me today about that. Otherwise, I'm just going to randomly put just the final last 4 students into groups. Some of our students don't know each other, and so they're struggling with you know, and especially in our virtual classroom now, they're just not sure of how to pick a group when they don't know each other. So if you could help out for students that aren't familiar with your class, that would be great. And then I'll post the topic sign up once the groups have been finalized. I originally had our Zoom sessions at 50 minutes. We tend to be going about the 60-minute mark, so I'll change them to 60 minutes because that's what we've been doing anyways. And then the chat feature, I'm not opposed to using the chat feature. What I'm finding myself is that it's very hard for me to monitor the hand up when you're putting your hand up, as well as toggle through my PowerPoint slides and other things, and then also look at the chat. So happy to use the chat, but I might not always see your question. And if students are seeing questions that I'm not addressing, if you could just yell out and say, oh, there's something in the chat, I would appreciate that help. So any questions about these announcements before I move on? I'm going to talk about the Think Global Act Local paper, and I'm going to ask for questions about that. But other than that, for these announcements or any other questions you have, if you want to ask them now.
I have a question.
Sure, Cassidy.
Hi, so for the choosing of the topic for your group,
Yes.
do you just need one member to choose it, or do all of you have to choose it?
That's a great question. Yeah, so when I do the sign up list, I'll ask for just one group member to pick the topic.
Okay, thank you.
Thanks.
I have one question. Does the topic you pick determine like what day you're going to present, or are you just going to randomly choose people to present on whatever date?
Yeah, I'm just going to randomly choose.
Okay.
And if for some reason there's a date, so there's 2 dates that we're going to be doing presentations. And so it's going to take place, I think this class, it's weeks, I want to say weeks 8 and 9, I think. So we're going to be doing them the days that we would typically be in class during the 3-hour window. So if there's one that you already know that maybe you're working or doesn't work for you, if students want to email me and let me know that, I can organize the schedule accordingly. Any other questions about general questions or about any of the announcements that I've listed here? Okay, I'm going to move on then. Okay, so the Think Global Act Local assignment, it is due October 1st, so it's due the beginning of week 4 at 9 in the morning. So just, you know, remember that time. So it's due beginning of week 4. Any questions about this assignment? Nana, I think you had a question. Yeah.
Last week you said that we need 5 sources in total, and that 5 has to include, like, let's say at least 1 or 2 from in-class discussions or readings. So I just want to ask, because some of the articles you provided does not come with a DOI. So if you plan to use something like that, how do we get that DOI to put into the reference, or do we just reference it without a DOI?
Oh, good point. Good point. Okay. So then I need to put a reference list up for you. Okay.
Okay.
Yeah. I'm writing that down. Reference list for week 2. Okay. Thanks for that. I will do that.
Thanks.
Paige,
We can use first person for this assignment, correct?
you can. I would rather, it still is a research paper. And so I would rather you didn't. I would rather you just spoke broadly, you know, as a nurse working in blah, 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 or as a nurse working in global health, because it still is a research paper.
Okay, thank you.
Brooke?
Yeah, hi. You said that you were gonna post like a way to cite the class lectures and stuff.
Yes.
Have you posted that yet?
I,
Or I haven't been able to find it.
no problem. I did post it within the announcements. I think I posted it last week in the follow-up announcements. And if you haven't seen it, has anyone else found
It's
it?
also posted. Somebody asked a question about it.
Yes.
It's a section for questions under class, and you answered that and posted a link to it.
Okay. So Brooke, let me know if you can't find it and I can send it to you. It should be within the announcements for week 2 follow-up. I think it was right down at the end, like number 6 or something.
Okay, I'll take a look. Thanks.
Okay, you're welcome.
Sandra,
Yes?
you said you're going to post the reference for week 2. Do you mind also posting for week 1 as well?
Sure. Yeah,
Thank you.
that's something I will start doing.
Okay, thank you so much.
Yeah.
I have a question in terms of like the kind of like interventions we would do as a nurse
Yeah.
when we're acting locally. Could it be like primary prevention strategies, or do you want, like in my paper, I'm talking about how, for example, sorry, I'm just trying to figure out how to say this. So my topic's diabetes, and I know that with diabetes, vulnerable people, they have a hard time getting access to nutritious foods or foods that are of low cost. So in one of my prevention strategies, I talk about how lowering food costs would be good for the society. Is that too big of like a
That's
intervention,
excellent.
or is that okay?
No, Leanne, that's perfect. And this week, I'm actually going to talk about upstream interventions, and that's a perfect upstream intervention.
Okay.
Yeah,
I
that's
just wanted to
great.
make sure, because I didn't know if you wanted something
Justina.
like we could do within our communities. I didn't know if that was too general or like kind of over top.
No, no, Justina, that's great. That's a perfect one. That's
Okay,
really good.
thank you.
Yeah. Leanne?
Hi. I was just wondering if we were collecting data from, for example, WHO,
Yeah.
would that count as a source?
Yes.
Okay. And the SDGs, would that also count as a source?
Yes. Yep. And they're found under the UN.
Mhm.
If you go under the UN.
Sorry, I have one last question.
Sure.
So it doesn't have to be an issue in every other country. It could just be like Canada and a couple other countries.
Sure. Leah, you can be very broad and do something that is global, or you could pick one country and compare it to Canada. It's just like, it's just looking at what is happening in other parts of the world that is also happening here.
Okay.
Yeah.
Okay, thank you.
You're welcome. Any other questions?
Sorry, I have like one more final question.
Sure.
I know because the word limit is a little bit shorter, so it's between 3 and 4 pages. Do you want, I know some professors like to state, like kind of give an overview of how our paper is going to flow, but for the sake of the word count, can we just kind of jump right into it?
Yeah, you don't need, for this paper, it's a very short answer paper. You don't need an introduction. So you're just going to jump
Okay.
right in with part one.
Okay, perfect.
Yeah.
Also, do you want the word count included at the end of the paper?
I don't need that.
Okay, cool.
No.
Thank you.
I just have one question, one final question as well. For the part in, I think in part two, where you ask how is, I think, Canada working towards whatever issue, do you have to list like a lot different actions, or can you just pick one action that Canada is doing towards whatever issue you're talking about and just talk about that issue, that action only?
So are you talking about when I'm asking, what can you do at the local level? Or are you talking about part one?
So let me just see if I can find the sorry. Yeah, where you say, how can this problem be addressed locally within existing healthcare or other systems? So I'm just asking if, let's say, whatever problem you have, or whatever issue you're talking about, if Canada has, like, let's say one, I guess, like maybe major thing that they're doing towards this issue, can you just talk about that only, or do you have to like find, I don't know, maybe two more things that we're doing?
No, as long as you pick one and you do a really good job explaining it, that's fine.
Okay.
Yeah,
Okay.
one is fine. Okay, I'm gonna be very rude and let my dog out because he's panting and looking at me. So hold on one second. It's probably gonna go bite the leg off the Purelator guy or something. Any other questions about this assignment? No. Okay. Well, I'm here at the end of class. If you have any questions, and you can always email me as well. And people have been emailing me their topic ideas. And if you feel that you're kind of not on the right track and you're not sure if your topic is a good idea, just email me and I can put you on the right track. Okay, so what's new in global health is what we're going to do next. So we keep hearing about how COVID is going to have long-term impacts. And this is something that came out of Nepal. And it's not just in areas like Nepal, it's in all areas where we've really fought to get girls back in school and kind of level the playing field between girls and boys in low middle income countries, that they're back in school. And the UN is finding that they're seeing that girls are marrying early, starting again. That had been stopped in many low middle income countries, but because of COVID and schools closing, we're seeing a lot of girls early child marriages. We're seeing a lot more child marriages, and the UN is warning that it could lead to, they say, 13 million more child marriages over a decade. And so this was out of Nepal, and they were just recognizing that they had made such great progress on gender equality in the recent years and getting girls back in school, and they fear that these hard fought wins are going to go in reverse. And so just one of the many things that we're going to see with the impacts of COVID. This was out of Japan, and their approach to COVID-19 is to try and coexist with it. And I think we're trying to do that in Canada as well. And so they haven't had massive lockdowns, but what they do push for, or they do try to avoid, are something that they call the 3 C's. And it's similar to what we're doing in Canada. So avoid closed locations that have poor ventilation, avoid crowded spaces, and avoid close contact settings. And so they've been able to try kind of keep their cases at bay and not go into overwhelming lockdown situations. And so it's kind of a middle of the way thinking, and it's going to probably cause them a little bit more time to get back to what we call normalcy. But that's just one way. We look around the world and we look at what people are doing, what other countries are doing, and that's just one example of what Japan is doing. And then the last one was just looking at the impact of social media. So we know social media has a big impact. And this was looking at different social media platforms. And in particular, this was Pinterest. And the health authorities are impressed with what Pinterest is doing. So Pinterest has a hardline strategy against misinformation. And in specific for this one was vaccine misinformation. And so they have a zero tolerance for vaccine misinformation that's not coming from health authorities. They have a team that enforces it. And they're just looking at the differences between Pinterest and Facebook, and that Facebook cites that they follow the idea of free speech as a reason for leaving up potentially harmful, unauthorized misinformation. And so this was just looking at the differences between Pinterest and Facebook. So any questions or any comments on those news items, or if you want to add anything else from what you may have heard or read this week? Okay, I'm going to move on then. Okay, so I'm going to do an overview of Module 3. So what I cover in these short Zoom sessions is really just a high-level overview of what to expect for the week. So you really need to dive into the material to get more information. So Module 3 is our only module that we're going to look at theories and approaches to global health and nursing. But we're going to be using these theories and approaches as we move through move through the remaining modules. And so this was just the one module that we're going to talk about theory. And so last week we looked at the socioeconomic determinants of health. We looked at the relationship between global health and human rights. And we looked at how can we provide healthcare that's culturally and racially just. And you worked on a participation assignment that looked at that. And so this week we're diving into some theories, and I picked a couple that are really relevant to nursing and global health. So we're going to look at the critical caring theory. We're going to look at social theories because we know that health is socially constructed. And then we're going to touch on 3 approaches to global health that work in global health and that I've personally seen work in my work in Ghana. So that's what this week's going to be about. So this is module 3.1 was looking at the critical care theory, critical caring theory. And this was a theory that was developed by Dr. Falk Raphael, who's actually was a professor at York University, has a PhD and works within the School of Nursing as an ad hoc professor now. And so this theory was developed to look at the role of the nurse in public health. And so oftentimes when we think global, act local activities, a lot of them are happening in the community setting. And so they're going to occur at the level of the public health nurse. And so this critical caring theory looks at the science behind what it is to be a public health nurse. And in turn, I found it a great one to look at the what it's going to be like to be a global nurse or a global citizen. And just, I have to tell you an aside remark, I received a text or an email from a student about 15 minutes ago who I wrote a reference for. And she graduated last year and she's just secured a 2-year position in public health in Durham. And we were just joking back and forth about how busy she is going to be as a public health nurse in the midst of this pandemic. So just thought I'd bring that forward. And so I talked to you about where critical caring theory came from. And the theory emphasizes the interconnectedness of human beings, the environment, and the universe. And so that's what we've been talking about when we think about global health, is that interconnectedness, that one health approach. And so the theory roots itself in the caring science and social justice. And if you look at the roots of the tree here, you can see that it roots itself in Watson's caring theory, which I don't need to discuss with you because you've heard a lot about Watson. It roots itself in Nightingale, which was quite an advocate for social justice. And then it uses the feminist critical theories. And why do you think the author has chosen that theory? Any ideas? Why would that theory have been chosen as one as the roots for the critical caring theory?
Does feminist theories look at the differences of power imbalances and inequalities?
Exactly, Dylan. That's right. And so it started off by looking at the gender equalities and the oppression of women. And what has happened is it's grown to look at oppression and vulnerabilities of all groups. It doesn't matter, it doesn't matter that you're not a woman. It's looking at so researchers have now taken this theory and taken it a lot broader to look at the barriers in society, the socioeconomic, the political, the barriers that cause certain vulnerable groups to be less healthy than others. And so they've taken it from that original oppression of women to be looking at inequalities of everyone. And so that's why it was kind of used as one of the roots. And so if we look at the tree trunk, we can see that it has something that will be familiar from Watson. The critical caring is a way of being, knowing, and choosing. And it's got a couple of other processes in the trunk there about preparation of self and developing and maintaining a helping, trusting relationship. And so to preparing self is to think about you as a nurse and to think about your position within society as a nurse. And so that was the trunk of the tree. And then if we look at the branches are focusing on your reflective practice and your praxis. And so what you can do within society to promote health as a public health nurse. So that was the first model that I thought, when I thought about this model in public health, I thought it really shines a light on what it means to be a global citizen as well, and that you're caring for individuals and families and populations and communities. And you're looking at the environments in which these individuals live and the policies that affect them. And so I thought it couldn't be closer to a global citizenship in nursing. So that's why I chose this is one of our main theories to think about, because it incorporates Watson and Nightingale, which you're familiar with. So the article that I posted for this week to read takes this theory. So it takes the critical caring theory and public health nursing, and it looks at the importance of comprehensive sexual health education for our adolescents. And we know the importance of sexual health education for our youth. And so this was one way just to apply the theory and see how public health nurses were using the critical caring theory to advocate for sexual health education. So any questions before I move on to module 3.2? So module 3.2 focused on social theories. And when you think of social theories, you think of kind of the world of sociology or the discipline of sociology. And it's really about coming up with, ideas or arguments or hypotheses of why or how societies have formed, and why society in certain communities, countries are different than other societies. And it's thinking about the structures that are in place that have caused the societies to be formed that way. And it's looking at how society has changed, developed, or maybe even disappeared over time. And so it's a way to think scientifically about a society. And so this article that I posted here looked at 4 social theories of global health to think about what in the realm of global health, why have some things worked, and what are some things that have come out of the social or the global health programs that have been put in place that have been kind of negative, that we didn't think may have happened. And so it's looking at these, the article is looking at these 4 social theories that I'm going to go through here to explain like why or how certain societies have formed or changed over time with respect to health. And so the first one is unintended consequences of purposeful social action. So what does that mean? So what is that? That's meaning that a lot of the things that we do in global health, we're coming from a perspective that it's a purposeful, positive social action, that we're going to make a real big change. But we don't recognize maybe some of the unintended consequences that have come out of it. And one of the big ones that I want to talk to you about is the when public health or global health tried to eradicate smallpox. And so there was a lot of coercion going on at that time. Sorry, I'm just trying to go to my next slide. And so one of the unintended consequences that we didn't realize following the coercive vaccination of smallpox is that we went into communities and we vaccinated everyone, really kind of against their will, but we just came in as authoritarian medical professionals that this is the right thing to do. And it was at the time the right thing to do. We were able to eradicate smallpox. But what this father is saying here, and this came out last year in India, is that what's happened is that polio is coming back rampant in India because of the fallout of the polio eradication and how it was so coercive and so authoritarian, like I said, that people were vaccinated against smallpox. And here this father is saying that there's so many people that are not having their children vaccinated, and this is his poor child that's suffering from polio. And so it led to individuals and community resistance to later vaccination campaigns. And so this was just, I thought, a great example to look at one of the unintended consequences that we thought wouldn't come out of being proactive and vaccinating everyone against smallpox. Any comments about that before I move on to the next social theory? Okay. So the next social theory looks at the social construction of reality. And we've talked about that society is constructed, but this is more looking at how culture has really made a difference, socially made a difference, and really played into what laws are passed in certain countries and enacted upon than others. So it takes on the idea that there's this culturally distinctive difference between countries with respect to certain ideas. And one of the examples that came from the reading that you're going to read this week was looking at abortion and looking at why are some countries so contentious and so crazy about their abortion laws versus other countries that are not. And so this was looking at the differences between abortion in USA and the contentiousness about abortion, but not in Japan. And the reason that they do have abortion laws in Japan, but what they realized is that there was they passed a law quite a number of years ago, like many like 40, 50 years ago, saying that there's a law called the Maternal Health Protection, meaning that if you're a woman in Japan and you were raped or for some other reason you feel that you cannot carry this child, that's okay, that you are allowed to have an abortion, as opposed to the attitude in the States where we're fighting over the right of women's bodies, and you're seeing different states in the United States have different abortion laws. And so these are all socially constructed. These are like culturally, socially constructed laws. And so that's what that's what this theory is looking at, is the social construction of reality. So that's just one example. The other example that was provided in the reading was looking at a whole idea when you're working in neurology and you're working with individuals that we can classify someone as brain dead in Canada. There's testing that you must go through. It's quite significant. I did a lot of brain death testing when I worked in the trauma unit at Sunnybrook along with physicians. And we're okay to say that someone's brain dead, but in other parts of the world, and then the article talks about in Japan, you would never be able to say that someone is brain dead. That is just not something. The testing and what have that goes along with that just wouldn't happen in Japan. And that's something that's just, again, it's culturally been developed over many years. So any comments or questions about that theory? Okay. The next theory of global health is social suffering. And social suffering looks at, we've talked about the social determinants of health that prevent people from being healthy. So it's all looking at the socioeconomic and the socio-political forces that hinder people from being healthy. And so one of the examples that they give in the article is looking at diseases of the poor. And one of the biggest ones is tuberculosis. And we call tuberculosis a disease of the poorest. And it doesn't need to be that way. And so it's the deep poverty or countries of poverty, or even think about what communities in Canada. It's the vulnerable communities in Canada that have the high rates of tuberculosis. So our Indigenous communities, our individuals, our inmates, our prison inmates. So these are all vulnerable communities, a lot of them very poor communities that are, because of poverty, have conditions for tuberculosis to flourish. And we'll learn about next week about antimicrobial resistance that goes along with tuberculosis. So social suffering, again, is looking at poverty in this specific example of how poverty keeps people sick. And tuberculosis, again, as I said, we call it a sickness of the poor, and it doesn't have to be that way. Countries that are not poor, so our middle to high income countries, aren't suffering from the tuberculosis numbers that we're seeing in our poorer countries or our poor vulnerable communities within countries. So that's what social suffering is all about. And then the last one is biopower. So biopower looks at how governments can control their citizens' body and health through a form of social control. And you can think about things such as sex ed in schools. So it's a way for governments to control the health education that we're giving our youth through government power. We can also look at how the governments can control women's bodies and abortion laws. And so biopower is saying that governments are holding power over people's bodies with the way that they control their society through policies and through laws. And so that's what biopower is all about. So any questions about the social theories?
I have a question about biopower.
Sure.
Would mandatory vaccines be an example of that?
Well, it definitely is a way to control people's bodies, for sure. We know that, families can go and get an exemption from vaccination, but, that's a really good example. So, mandatory vaccination, for sure, we could consider that control over people's bodies by the government, by health authorities. Yeah, that's a good one. Any other comments? Okay. So the last lesson was looking at ways to promote global health, and 3 ways that I've seen that actually work. And so what I wanted to start off with is thinking about when you think of models of health, and you think about, how has my nursing practice been framed? What approaches have I learned, or models of health that I've learned through the 3 going on 4 years within your BSCN program, what kind of models of health have you learned about that has kind of framed your nursing profession? Does anyone want to take a stab at maybe some of the theories that you've learned about that has made your nursing profession, or what's your approach to your nursing practice?
Hi.
Hi, Cassidy.
For myself, I feel like I looked at like Watson's human care in theory and kind of understanding that there's more to a person than just the sickness. It's, you know, their family, community, who they're around that like really makes up the whole picture.
Exactly. And so a lot of us, not a lot of us, but I would say a lot of the physicians learn about that biomedical model. And you're saying exactly. So biomedical model is just focusing on the disease, but you're learning more about being broader. Watson's theory is looking at all those social determinants of health. It's looking at, you know, and that's a model, the social determinants of health model, or the socio-environmental model. Exactly. So that's great. Dylan?
Yeah, I was gonna say the same thing. Back in the second year when we were learning about Watson, I actually had a really interesting patient experience. It was like exactly out of like a theory textbook. But I I had a patient on a surgical floor that had came back from surgery but lost a lot of blood. She was like just in her mid 60s, but she was a Jehovah's Witness, so she refused blood.
Yes.
And a lot of nurses and physicians on the floor like were angry, didn't want to like interact with her. There was only a few people that would actually care for her throughout the day. She ended up having a heart attack, stuff like that, related to like low hemoglobin.
Wow.
But then when I talked with her and stuff like that, and just like asked her like why she was like refusing it, you know, she could be so much better off with it. She told me that like in the Jehovah's Witness, if she refused the blood, she would be like excommunicated from her family, from her community, from everyone that was visiting her in the hospital, her entire support system. So that's when like I really understood that like how, while the biomedical could tell you that how to fix your body physically, by doing that, it would also the impacts of like the well-being of losing everyone else in her support system would be more detrimental to her.
Right. That's a great example. Excellent. Paige?
So just like an extremely broad term, but that we've been hearing since we started is just patient-centered care.
Right.
And I think that encompasses like all the theories we're discussing. And yeah, there's not one class that we've had that like it's not mentioned. And I feel like that's the difference between like some nursing programs, even between the schools, and even like physician education and nursing education is the patient-centered aspect of it.
Right. Absolutely. JJ?
I think another, can you hear me?
Yes, I can.
Okay. I think another model that framed my practice was Parsi's human becoming theory. I think a huge part of it is like when providing care for individuals with chronic illness, I think they are the one that know the best about their quality of life. I think as healthcare professionals, we shouldn't be judge their quality of life based on their biomedical diagnosis.
Right.
I think they know themselves the best.
That's so great. Yeah, I agree. And I've actually when I was working in cardiac surgery as a nurse practitioner, if you're a diabetic and you go through surgery or a stressful event, you will have hyperglycemia. Like it's very hard to get brittle diabetics under control after heart surgery. And what I will do is I will speak with the patients and saying like, what would you do? You know your body more than I do. Should we be giving you 30 units of insulin in the morning? Like if this was happening at home, what would you do? And so very similar to what you're saying is asking the patient what they would do. They know their body better.
Right.
Yeah. Yeah.
Thank
That's
you.
a great example. Anyone else? So yeah, go ahead.
I use it's a theory, but I'm not sure if everyone knows about it. the modeling and role modeling theory by Erickson.
Oh
Like
yeah.
Margaret Eric, yeah. So in
Okay.
that sense, I use that in the sense that I put myself in the, it's basically just being, why am I not remembering my words right now?
Well, it's very much putting
Yeah,
putting yourself in their position.
Yeah, that's pretty much it. I'm
Yeah.
being empathetic. Yeah, that's the word I was
Yeah.
hunting for.
That's right.
Empathy. That was pretty
Empathy.
much it. So I was putting myself in their position, and then the role modeling stage is where you end up taking their position and you apply it to any interventions. So you're
Right.
just making it unique to the patient's experience.
Right. That's a great one. Yeah. Anyone else want to discuss any of their theories or models that they use? So you've hit on the ones that typically you would think of. So you've hit on the biomedical model, patient-centered care, empathy, looking at the patient as a whole, looking at the social determinants of health. So one of the ones that I talk about in the online module is the behavioral model. And that's a model that we have to be careful about. The behavioral model is us saying that everyone can make healthy lifestyle choices, that we can tell people to eat healthy, we can tell people to stop smoking, we can tell people to exercise. And the behavioral model saying that you can change your behavior. And I think we all know that the choices we make are based on the choices we have. And so there are times that we can't make those changes for other upstream reasons that we can't make those changes. So that was a model that I also spoke about in the online module 3.3. But otherwise, you've hit the same ones that I've talked about, that I've been talking about. So I want to just touch on three maybe different approaches, but you're going to be familiar with them all. But just the ones that I have personally seen from my research in global health, but personally seen actually physically work in global health. And these are approaches that you can use in any local community, any global community. And so the first one is primary health care. And so for most communities in Canada, we are very lucky to to have access to this type of care, primary health care. And so the premise behind primary health care is that all people everywhere, regardless of what community you live in, what country you live in, deserves the right to care, but deserves the right to care right in their community. And so this is the fundamental premise behind primary health care, is that healthcare is readily accessible in your community. And so what it does is it's very people-centered, like you were talking about, as opposed to the disease-centered care. So it kind of moves outside of the biomedical model. And when you listen to my lecture, I talk about the biomedical model being this very vertical type of approach, that we're only disease-oriented, we're only looking at diseases. We're not thinking about, why certain people, we're thinking about diabetics, but we're only thinking about the narrow approach that we need to treat them with insulin. But the broader approach would be looking at, do they have good food to eat? Are they able to pay for their insulin? Do they have literacy skills? Like thinking, that's the broader part of primary health care. And so it also is a very broad approach where it looks at promotion, it looks at curative, like the vertical biomedical model, but it also looks at rehabilitation, long-term care, palliative care. And so primary health care, it looks at, your whole lifespan. And so primary health care has three components. And so I'm going to go through how we've taken a primary health care approach in my work in Ghana. But I want you to also think about how you can use a primary health care approach in our vulnerable communities in Canada, in Ontario, in Toronto. Think about the vulnerable communities that if we could just plop down into a community, a nurse-led clinic, an NP-led clinic, where in a poor community in Toronto that didn't have access to a dietitian, so that has access to a dietitian, a dentist, an optometrist, a nurse practitioner, a nurse, this is primary healthcare, is putting the healthcare where it needs to go. So this is something that works everywhere. And so I just want to show you my examples that we looked at in our work in Ghana, but you can apply this to any local setting. And so the first part about primary healthcare is looking at meeting people's needs throughout their lives. And it's actually looking at communities and asking them what they need. So if you were to think of the poor communities in Toronto, it would be going and doing a town hall there and saying, like, what do you need? What is it that you need in your community? And so this was an example of women from different tribes coming to us when we were setting up this happened about 5 years ago, setting up our clinics. And the women approached us and through a translator said, our babies are dying. Our babies are being born and they're dying. And so we investigated while we were there and tried to understand why they had such a high neonatal mortality rate. And it was because babies were born, but they were born flat, and all that needed to be done was the baby needed to be resuscitated. So it's very common in any like high income country, if a baby is born, you always have a nurse there that's suctioning the baby. You have a nurse there that can bag the babies with an ambu bag to get them breathing. Sometimes they slap the baby because you want them to take that deep breath and open up their airway. And what was happening is these babies were born in that state and they thought they were dead and they didn't know how to resuscitate them. And so we developed this program called Liata, and in Ghanaian language, it's called Rescue Us. And we received a grant from the Canadian government, $1 million. And what we did was 2 physicians from our group here in Uxbridge went and spent 2 weeks there, and they brought equipment with them, and they taught a woman from each village how to resuscitate a baby. We showed them how to recognize the signs and symptoms if a baby is flat. We brought the little nasal aspirators that you could put in the baby's nose and aspirate it out any fluid. We brought the bag Basque valve hand pumps, so the ambu bags. We left every community have one of those. We taught mothers and these community care workers how to recognize if a baby within the first week of life is distressed. Do they have a fever? Are they not feeding well? And I would say the neonatal mortality has dropped by 20 to 30%. It's unbelievable. And that's only by figuring out what a community needs. And so this is a great example of the first kind of approach of the primary healthcare model, is recognizing what individual communities need. So that was just one example. And we've received, we've actually of the original 20, I think it was 20 to 30 mothers that we trained in the villages. Now these mothers are going out and they're training other village mothers in other villages by simply just, giving them the tools that they need. So that was just one great example. The second approach to the primary healthcare model is looking at those broader determinants of health and recognizing that health isn't just about providing healthcare. It's looking at what else is needed in communities to provide health. And so what we did as in our NGO is that we recognize people can't be healthy if they don't have water and sanitation. And so we drilled 125 wells in the areas to make sure that people had proper water, good clean water, and we built proper toilets. We built schools. So 10 schools were built, and we provided scholarships for students to be able to go on past post-secondary school. And this is all done by volunteers. And it's done by, so the volunteers were individuals that went and helped build these wells. And then we do fundraising that helped for the material for the wells and to help with some of the scholarships. But it was all volunteer work that built these wells and built these schools. And so just looking broader than just providing health, like providing healthcare and our little clinics is very important, but just looking more than that. And so again, these are things that can be done in our very local communities, that are our poor, vulnerable communities, providing, you know, good education in these communities. And then the last part is just empowering people, empowering communities, empowering families to take charge of their own health. And so I talked last week about some of the empowerment things that we had done with partnering up with Body Shop. And so we developed some women's programs that we found that women who became widowed because their husband had died early were actually suffering. And so we developed this shea butter program to allow women to be self-sufficient, to be able to provide for their family, and be able to have really, they're still subsistence living. They're just making enough to survive, but they're making enough to survive to buy good food. They have their children to be able to go to school. And just empowerment that these women are actually now self-sufficient and can provide for a family when, you know, maybe there is a father that's not in the picture anymore because they do have a high rate of stroke and death. So I just wanted to give you some ideas of the principles of primary health care and how it does work, and it can work in any community and any country in the world. So any comments at all about the primary healthcare model? Okay, so this was just a slide, just, you know, bringing it all together, what I said. So, you know, bringing everything to individual communities, asking what they need, empowering them to be healthy, giving them the tools to be healthy, and watching them grow. And it works. It works. We see, most of us are fortunate to live in communities where we have primary health care, but a lot of communities could really benefit from this type of model of care. The next one, which I'm sure you've heard a lot about, is this whole idea of upstream and downstream approaches. And so for most health professionals outside of nursing, because you know the importance of thinking a little bit broader, but I would think most health professionals training is focused in downstream approaches. And so focused at the individual level, you know, telling individuals that they need to stop smoking, they need to improve their diet, but not looking back at the upstream reasons of why that can't happen. And so some examples of upstream and downstream approaches, one that I like to think about, and I think is a great example, is food security. And so one of our downstream approaches is that when we see people in Toronto, when we see that food security is a problem, what do? We open another food bank. We open another food bank. This is a downstream approach. An upstream approach would be looking at, are there fair food prices? What about community gardens? Do people have access? Are people able to buy food? Is there a local grocery store in communities that maybe are vulnerable and food insecure that they can go to instead of a local variety store? So it's looking at how the upstream and how communities are built and thinking about, well, maybe that's why they're food insecure. And so just looking at, you know, we tend to go to the downstream approaches when we need to go upstream. Another would be when we think about our smoking rates, and we're prescribing the nicotine patch, we're prescribing nicotine gum, we're telling people to stop smoking. But what Canada did, along with other countries, is we went upstream and we made it harder to smoke. You couldn't smoke in public places. Now, when you buy cigarettes, you have to be a certain age. When you go to buy cigarettes, they're behind a covered thing that, you know, you have to open up to get them. And so going upstream. So can you guys think of, if we were to think of like the opioid crisis, what are some things that, other than downstream approaches to the opioid crisis, what are some things that we could do upstream to help with the opioid crisis? Any ideas? Dylan?
I think one upstream approach that is going to be coming around in the next few years is universal basic income.
Yes. Yep. That's a great upstream approach. Yes. Any other ideas for opioid crisis? We're going to talk about this when we head into, we'll talk about the opioid crisis, but Katrina?
Well, kind of like the article speaks about to sex education, like maybe teaching more in schools or like to adolescents about the opioid crisis and yeah, just providing more information to like the younger populations.
Right. Yep, that's a good one. Dawn Amber?
Perhaps like prescribing less opioids during surgery and stuff like that, because that's where a lot of people become addicted. So, I mean, I don't know, obviously that's not an option for everybody, but maybe investing money in finding drugs that don't have an addictive quality to them that still would prevent pain that people are experiencing. Obviously, that's a big feat to state, but that might be an option as well. Investing more into research for that.
Excellent. So different approaches to pain management other than opioids. That's a good one. Shamar?
I want to ask the question, why is there a crisis, right? And if you think about it like that, you could see that some people, maybe if they're stressed out from their life, like what is the thing that leads people to find opioids as their place of refuge? Go from there, and then you could probably get a pretty broad idea.
Okay, so Shamar, you've hit on something close to home for me. So my son just finished high school, and they went through a really big opioid crisis in their high school. And I went in and spoke to the principal numerous times and said, you need to have mental health programs in this school. That is going to fix your opioid crisis. They wouldn't listen to me. I offered as an MP to go in once a week and spend a day helping with mental health, getting students set up with counselors, and I fought for that. And you're so exactly right. Why do we have an opioid crisis? What's happening? That's great.
I have just a comment of something I read about in the States of how pharmaceutical companies were like paying physicians to prescribe certain opioids to low income or people who are vulnerable groups in the States. I don't know the extent of that.
Yeah, that's how Percocet happened with the Purdue, I think it was Purdue, that they've been charged with millions, billions of dollars for doing that. Yeah, you're right. Yeah. Brooke?
I just had a question. Would you say that a harm reduction clinic is a downstream approach?
So this is great. It is downstream in that it's allowing, so we're gonna this is we're gonna talk about harm reduction too. It's downstream in that it is focusing on individuals still using opioids, but it's upstream in that it gives an opportunity for individuals who are using opioids to come into a safe space that they aren't looked upon as, the scum of the earth. And they're coming into a safe space with nurses, and from there, they can get other healthcare needs if they want it. They can get an opportunity. They provide them opportunities to try and find a job if they want. They provide opportunities for education. They provide a dentist. They provide counseling if you want it. So that's the upstream approach of it. And so it's kind of a mix of both, I would think. Katrina, is your hand still up? I wasn't sure if it was up from before. And Dawn Ember as well. Okay.
No, sorry, I just forgot to take
it. And Andrea, your hands, was that from before? Okay, thanks.
I just wanted to add something, if that's okay. So when we were kind of talking about, or someone else mentioned the need for more education in schools about the opioid crisis, that kind of also led me to think about how a lot of the times, at least from what I've learned, the individuals who seek out opioids and eventually end up using opioids, it's because of the social determinants of health that have kind of put them in a position where they end up using them. So I think even just improving education in these more vulnerable communities by putting more funding into them or allowing for more for better education for these individuals can help them as well, just as a social determinant of health, because they all kind of tie together. Education will allow for better working opportunities and et cetera, et cetera. I think that would be kind of a good upstream approach too.
Andrea, that's excellent. That's exactly right. Yeah. I'll take one more question and then we'll move on because I recognize it's 10:30. JJ? Or one more comment, I mean.
Yeah, just gonna make a comment. I absolutely agree with Andrea was saying. My sister, she went to Northwest Territory to like volunteer in a high school, and then she told me there's no mental health program at the high school. So I was just gonna add on to that, like that could lead to like First Nation opioid overdose as well. So I guess adding on like high quality education for the public is absolutely essential.
That's great. I agree. Well, so those are fantastic upstream approaches. And so the next, the last and final, approach to global health, it takes it all in, it's taking everything you've said and calling it something. This is called the health in all policy. And basically it's everything that you're saying is that when we think about health, we can't only think about the health sector. We need to think about the housing sector, the nutrition sector, the education sector, the water and sanitation sector. And that when these other sectors are thinking about laws or policies that they're approving, we need to think about, is there a health impact to these policies? And so it looks at all sectors working together. And so very similar to what you've been talking about when you were talking about education and when I was talking about nutrition, that we need to think upstream and thinking about the other sectors in our society, that we need to look at different policies. And so this is called a health in all policy. And you'll see it quite often in the global health world, and it could actually is a local thing that should be happening in our local communities as well. So that's the third one. So just three programs or approaches to public health that the global health that I've seen that work. So the primary healthcare model, upstream and downstream approaches, and this health in all policies. So remember to do your ePortfolio weekly reflection tool. So it's at the end of week 3. Remember that your paper is due at the beginning of week 4. And then next week, we're going to go into a concept called structural violence, and we're going to look at the Partners in Health model, which is you'll see things that we've talked about in this lecture. You'll see them in action, especially with the Partners in Health model. So I am going to, I realize that it is 10:35. So I'm going to stay on for as long as you need me to stay on to answer any questions about anything. And people are welcome to sign off now if they want. If they want to stay on, that's fine too. So Nana, I see your hand up.
Yes, hi. I just wanted to ask, the assignment in week 3, the discussion, is that part of the 7 participation assignments we're assigned this semester?
No, it's not.
Okay.
No, and I think I tried to make it, I tried to say this is not graded.
Okay.
I did say that. So that's just a quick way for you to be engaged with the material.
Okay.
So I'm trying to promote as much engagement as possible, but it's definitely not one of the participation, and I'll make it even clearer than what I've done.
Okay.
Yeah.
Andrea has a question in the chat. She said, can the global health issue that we choose be something more related to preventing a health issue, that is lack of sexual education or sexual health promotion?
Exactly. Yeah, for sure it can. So you would need to think about what is the actual health issue. So is the health issue sexual and reproductive health and rights? Like, what's the health issue? And then your suggestions would be the lack of I'm thinking, oh, well, not necessarily. I'm trying to get into the chat so I can see this. Okay, so hi, Andrea. Be something related to preventing a health issue. Yes, so actually I'm gonna just ignore everything that I've just said. And yes, so your health issue, yes, could be lack of sexual health education globally around the world, and then focus on what can be done at the local level, right? So yes, those are fine, yeah. Any other questions that people have? Kalista?
Yeah, so just to clarify, our issue should be like global, but then our action is local. Like, does need to be an action that would take place globally?
So how I usually try and frame it is that I want you to think first about an issue that's happening around what you think. This is a global issue, but it's actually happening locally as well. So let's say diabetes. So you pick your issue. What you need to do first is figure out what are the, why is it happening, not why, what are the statistics saying that I know that it's a global issue? So the best places to go for information on that is the World Health Organization. So you would start off by saying, diabetes is a global problem. The World Health Organization says blah, 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 blah. And then you would switch and you would say, but it's also a local issue. And you pick whether you want to say whether you want to focus narrow like Toronto or Ontario, if you want to be broad like Canada. So you might go to the Canadian Diabetes Association. And so you would say, yes, it's a global issue because the World Health Organization is saying this. And then you would say how it's also a local issue by saying, you know, the Canadian Diabetes Association is saying this or what have you. So that's how you start off. That's kind of part A. And then part B is saying, okay, so it is a global issue, but it's a local issue, as I've said. And what can we do at the local level to decrease our numbers of diabetes? Does that help?
Yeah, that helps a lot. Thank you.
Okay, perfect. Shamar?
I have a question about the assignment. Well, it's more about my my topics.
Sure.
I'm debating between, well, one of them is pretty abstract in the sense like it's like internet addiction, social media use and all that. And I was trying to find if that was appropriate for me to use for something.
That's a great one. It just, do you have any statistics or that it's happening, like it's a global problem?
It's something I've looked into, and it says it's a Western society problem mainly.
Okay.
Is that?
That's good, as long as it's not just focusing just, so you need to be a little bit broader than just Western society. So for it to be a global issue. So see if you can find, I don't know if the WHO has any information on that or not, but you would need to show that it is a broad global issue, that it's happening everywhere.
Because my other option was going to be single parent households, but then at the same time, it's a mixed bag for how that goes. But I could see why, boiling back to like the social value it would have. Right. Saying that in the Western societies, it's more of an issue than some of the Eastern societies. So
yeah, I think that may be easier to find research on. I think the internet addiction is a great, let me think about that for a second, because we are seeing a lot more internet addiction happening in our low middle income countries.
Because what I was mainly looking towards was the mental health effects. Right?
Okay.
Like with social media, for example, you see that some people do these challenges which aren't safe for their health, or like people are becoming more depressed and anxious because of social media, or they rather play games all day and stay at home, which ends up leading to unhealthy behaviors, for example, not really being physically fit, or eating junk food all the time, things like that.
Okay, go ahead.
Or even like another thing I was thinking about writing about too, in that was that people end up trying to emulate the actors and all that they see on TV or models on Instagram, Facebook, and all those kind of things. Then there comes the misinformation through social media when it comes to the groupthink mentality. And those are the kind of things I think about writing about. But I'm like, then again, I don't know if that's something that would be appropriate.
I'm writing down these things because I'm going to try and see if I can help you with some research. So misinformation in the social media is another one. Yeah.
I have a comment about that.
Sure.
If possible.
There's
a documentary that was just released on Netflix called The Social Dilemma, and they talk about a lot of statistical data around the social media overhaul of our world and how it is making people addicted. And there's a lot of really good information and sources they mention in there.
Okay. So I'm thinking, Shamar, that's probably, I think maybe your topic, you may find more information, is like misinformation on social media. I think maybe that's, or the impact that social media is having globally too, like from a negative perspective, like all the things that you've talked about. Let me see if I can, I'll take a look and let me see if I can find somewhere that you can go to find some more like global statistics about that.
Okay, fine.
Okay, yeah, let me think about that. Any other questions?
Yes, I just have a question. So I'm just going to give an example that I can think of. Let's say you find a statistic that's saying maybe this whatever issue had a, I don't know, 30 point something million in 2012. It's kind of far away, but can you still use that statistic to prove that it's a global issue, or do you have to find something, let's say, that's more recent in like I don't know, 2018 or something like that?
I would try and find something within the last 5 years.
Okay.
Yeah. Any other questions? If you're not sure just about your paper, just again send me an email and I can kind of set you on the right track. If you've got a question or you're not sure your topic, or you need to kind of flesh out your topic a little bit with me, we can do that. Okay, so I'm not seeing any other questions. Sorry, didn't mean to do that. So I'm not seeing any other questions. So I will end our meeting. And again, email me, post it to Moodle or eClass if you've got questions. And if not, we will see each other next week, same time. Okay, so have a great week. And we'll see you guys next week. Bye.
Thank you.
You're welcome.